Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the determinants of learning, under which we will see about learning needs. Let's get started. Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we'll learn about readiness to learn as one of the determinants of learning. You can check the link below for the previous video. Let's get started. Readiness to learn means how prepared and willing a learner is to start learning something new. It includes their motivation, interest, and physical, emotional, and mental state at the time of learning. When a learner is ready, they are more focused, attentive, and eager to take part in learning activities. In simple terms, readiness to learn helps decide when a person is ready to learn and how well they can understand and remember new knowledge, skills, or attitudes. For example, a nursing student who is well-rested, motivated, and emotionally calm will learn a new clinical procedure more effectively than someone who is tired or anxious. Readiness to learn ensures that the learner is in the best condition to absorb and apply what is being taught. Now, let us see the significance of readiness to learn in nursing education. Readiness to learn plays a very important role in ensuring that students gain knowledge and skills effectively. It helps the teacher decide the right time, teaching method, and learning environment based on the learner's physical, emotional, and mental preparedness. When students are ready to learn, they can understand and remember information better. It also ensures that learning is effective, lasting, and meaningful, as students are more engaged and motivated. Assessing readiness helps prevent frustration and poor performance, which often occur when learners are not prepared or interested. In nursing education, readiness to learn also promotes self-directed and motivated learning, especially during clinical practice, where students must take responsibility for applying theory to real-life situations. By understanding a student's readiness, educators can create supportive and positive learning experiences that lead to competent and confident nursing professionals. Next, we will see about the types of readiness to learn. The first type is physical readiness. Physical readiness refers to the learner's physical capacity and overall well-being to take part in learning activities. If a learner is healthy, well-rested, and physically comfortable, they can focus better and participate actively in the learning process. Some important indicators of physical readiness include having adequate rest, nutrition, and good health, being free from pain or discomfort, having proper sensory and motor abilities such as clear vision, good hearing, and hand coordination, a comfortable learning environment with good lighting, seating, and temperature. For example, a nursing student must be physically alert and comfortable during a skills lab session to learn a procedure like IV cannulation effectively. If the student is tired or uncomfortable, it becomes difficult to concentrate and perform the skill correctly. The second type is emotional readiness. Emotional readiness refers to the learner's emotional state and attitude toward learning. Emotions play a key role in shaping a learner's motivation, confidence, and willingness to participate in the learning process. When learners are emotionally balanced and confident, they can focus better, think clearly, and respond positively to new experiences. Some important indicators of emotional readiness include emotional stability, being calm and composed during learning activities, motivation and interest in the topic being taught, self-confidence and self-esteem, which encourage active participation, low levels of anxiety or fear, allowing the learner to concentrate and perform well. For example, a nursing student who feels anxious about performing injections may not be emotionally ready to learn that skill. A teacher should provide encouragement and emotional support to help the student overcome fear and build confidence before beginning hands-on practice. The third type is experiential readiness. Experiential readiness refers to how a learner's past experiences background knowledge, and previous learning influence their ability to understand new concepts. Learners who already have some experience or familiarity with a topic are usually more confident and better prepared to learn advanced material. Some important indicators of experiential readiness include prior exposure to related concepts or practical skills, life experiences that connect to the current topic, the learner's stage of academic or professional development. For example, a third-year nursing student who has already had clinical exposure will be more ready to learn advanced nursing procedures than a first-year student with no prior hands-on experience. The knowledge and confidence gained from earlier experiences make it easier for the learner to understand and apply new information effectively. The fourth type is intellectual, cognitive readiness. Intellectual readiness refers to the learner's mental ability and intellectual capacity to understand, analyze, and process new information. It determines whether the learner has the necessary background knowledge and thinking skills to grasp more complex concepts. Without sufficient intellectual preparation, learning advanced topics can become confusing or overwhelming. Some key indicators of intellectual readiness include the learner's level of education or intellectual development, critical thinking and problem-solving skills that help in applying knowledge, understanding of basic or foundational concepts related to the subject, reading and language proficiency, which supports comprehension and communication. For example, a nursing student must have a clear understanding of anatomy and physiology before learning more advanced subjects like pharmacology or medical surgical nursing. This prior knowledge forms the foundation that allows the student to understand how drugs affect the body or how to manage complex patient conditions effectively. The fifth type is social readiness. Social readiness refers to a learner's ability to interact effectively with others and participate actively in group learning environments. It involves the social and interpersonal factors that influence how learners communicate, collaborate, and adapt within a team or classroom setting. When students are socially ready, they are more open to sharing ideas, cooperating with peers, and learning from group experiences. Some key indicators of social readiness include the ability to work collaboratively with classmates and instructors, strong communication and interpersonal skills that promote teamwork, adaptability to group dynamics and a positive attitude toward cooperative learning, cultural or social acceptance within the group, fostering a sense of belonging and comfort. For example, during group-based simulation exercises, students with strong social readiness tend to perform better in teamwork and communication tasks. They can coordinate effectively, support one another, and contribute to achieving the group's learning goals, skills that are essential in real-life nursing practice. The last type is developmental readiness. Developmental readiness refers to how a learner's stage of growth and development, including physical, psychological, emotional, and academic maturity, affects their ability to learn. As individuals grow and gain experience, their thinking, judgment, and sense of responsibility improve, making them more capable of understanding complex concepts and managing independent learning. Some key indicators of developmental readiness include the learner's age and maturity level, which influence concentration and independence, the stage of moral and ethical reasoning, which affects decision-making and professional behavior, the level of professional identity formation, or how much the learner identifies with their nursing role and responsibilities. For example, younger nursing students may need more guidance, supervision, and structured learning, while senior nursing students with greater maturity and clinical experience are often capable of self-directed and independent learning. Understanding developmental readiness helps educators adjust their teaching methods to match the learner's level of growth and capability. Now, let us see about the factors influencing readiness to learn. A learner's readiness to learn is shaped by many factors that affect how well they can focus, participate, and absorb new information. These factors can be physical, emotional, mental, social, or environmental. Understanding them helps teachers create the right conditions for effective learning. The first one is physical factors. These include the learner's health status, energy level, fatigue, and hunger. A healthy, well-rested learner can concentrate better and actively participate in learning. Example: a student who is tired or hungry may struggle to pay attention during class. Second one is emotional factors. Key. Emotions such as anxiety, fear, stress, confidence, and interpersonal relationships play a big role in readiness. Positive emotions and supportive relationships improve focus and participation. Example: a confident student feels more comfortable practicing clinical skills in front of others. Then, cognitive factors. These relate to prior knowledge, intellectual ability, comprehension level, language skills, and attention span. A learner with a strong foundation can easily understand and connect new concepts. Example: a student who already understands anatomy can learn nursing procedures more easily. The next is motivational factors. Motivation drives the desire to learn. It can be internal, like personal goals, curiosity, or interest, or external, like grades, rewards, or recognition. Example: a student who wants to become a skilled nurse is internally motivated to master clinical skills. The next is developmental factors. These depend on the learner's age, maturity, and stage of professional growth. As learners grow, they develop better judgment, reasoning, and responsibility. Example: senior nursing students are often more independent and responsible learners than first-year students. Environmental factors. A. The learning environment plays a big role, including classroom setting, availability of teaching aids, clinical exposure, and the teacher's approach. A comfortable, well-organized, and supportive environment enhances readiness. Example: a bright, well-equipped skills lab encourages active participation. Period. Sociocultural factors. These include cultural beliefs, family background, and social support systems. A supportive family and an accepting social environment can boost a student's confidence and motivation to learn. Example: a student from a supportive family feels more encouraged to pursue studies and perform well in clinical practice. P. Now let us see about the strategies to enhance readiness to learn in nursing students. Readiness to learn is very important in nursing education, as it helps students gain knowledge, skills, and confidence more effectively. Teachers can use different strategies to prepare students for learning and make the process more meaningful. The first strategy is to assess learning needs. Before teaching, the teacher should identify what students already know and what they still need to learn. This helps in planning lessons that match the learner's current level. For example, conducting a short pretest or discussion before starting a new topic can help the teacher understand the student's prior knowledge. The second strategy is to motivate learners. Using real-life clinical examples, interesting stories, and positive reinforcement helps make lessons engaging and relevant. When students see how what they are learning applies to patient care, their motivation increases. For example, a teacher can explain how mastering infection control directly improves patient safety. The third strategy is to create a safe and supportive learning environment. When students feel respected, comfortable, and free to ask questions, they learn better. Reducing fear and anxiety helps them participate actively. For example, teachers can encourage open communication during skill demonstrations so students can ask questions without hesitation. The fourth strategy is to link theory with practice. Learning becomes more meaningful when classroom lessons are connected to real clinical situations. For example, while teaching wound care, the teacher can relate the topic to cases students had seen during clinical postings. The fifth strategy is to encourage self-directed learning. Students should be guided to take responsibility for their own learning by setting goals and reflecting on their progress. This builds confidence and independence. For instance, students can be asked to write a reflective journal after clinical practice to assess their own growth. The sixth strategy is to adapt teaching methods according to the student's readiness and learning styles. Some students learn better through lectures, others through demonstrations, discussions, or simulations. For example, role play can help active learners, while visual aids support visual learners. A last strategy is to provide feedback and encouragement. Constructive feedback helps students understand their strengths and areas for improvement, while encouragement boosts their confidence and motivation. For example, praising a student for correctly performing a skill and gently guiding them on what to improve helps build both competence and confidence. In summary, by assessing needs, motivating learners, creating supportive environments, connecting theory to practice, promoting self-directed learning, adapting teaching styles, and offering positive feedback, teachers can greatly enhance nursing students' readiness to learn and make their learning experience more effective and enjoyable. That brings us to the end of today's session on readiness to learn. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.